So this is Board of Health meeting, Tuesday, March 2nd,
Thursday.
Thursday, March 2nd, 2023, sorry. 6 p.m. land use room. It's a Zoom meeting, hybrid. And present at the meeting is Sue Braska.
Jean Nilsson.
Tricia Sutton.
Christine Southworth.
Tom Hibbert.
And Mackenzie hopes to Zoom in maybe a little later when she can. There's no participants for public comment.
Nope.
Okay, so the review of minutes, the February 2nd minutes and the February 16th minutes were emailed previously. Any corrections, any comments on them?
No, I believe Mr. Hibbert made one little correction.
Yeah. Yeah.
And
Okay, so then I have to correct it on my copy.
did you revise?
I don't even remember. Do you have the copy here?
Yeah, it was just like one
It was
word.
just one word.
Yeah.
Yeah.
So, it was just on the
Oh, the end of the section about the master service agreement. It said
Right.
submitted the application, but it was a contract. So it was just submitted the contract to DPH.
Is this on the 16th?
Yes. Yep.
so instead of application, it was the word contract.
And where
That's
is it
it.
on here?
Yep. The last paragraph of the page under grants at the bottom, just the application to contract.
All right, so that's the only one I have to change.
Yeah.
Yep.
Aside from that, I'll make a motion to accept the minutes of February 2nd and February 16th.
Based on that. And I second that. And all in favor?
Jean Nilsson, aye.
And Sue, yes. So I'll retype that and we can sign the last page.
Good job on the minutes, sir.
Thank you. And Tom sign them too.
Is there anything you guys want me to do with the minutes as far as submitting them or keeping them in the folder, or you guys have that under control?
I'll take care of it.
Okay.
2 copies for downstairs and a copy for ours.
One copy goes to the town clerk's office, the other goes to the select board's office.
Okay. Perfect.
And then we keep the original in our file.
Yep.
So,
Okay, so with the February second minutes goes your reports
Yes,
for
right.
January. Yes. And with the minutes from today will go your reports from February.
right.
Let's keep it that together. So. You guys are on.
Yeah.
Whoever wants to go first.
Oh, that means somebody's here.
McKinsey.
No, Cliff
No.
Clark from the Westfield.
Yeah, I believe he's the new reporter.
Okay.
What's his name? He's gone.
Peter?
Peter's
Peter,
done?
Peter
Okay.
Courier
Okay,
is gone, so,
this is Clark.
Cliff-
yeah,
Cliff
Hi,
Clark.
Cliff Clark.
He's muted and got his video off. He's just here to watch, but
Oh, okay.
No, I'm here.
welcome.
So first name is
You're Cliff, right?
That's correct.
And you're Peter Courier Part 2, right?
Actually, he's probably a little bit below my pay grade, but that's okay.
Okay, welcome.
yes.
And please let us know if you have any questions either during or at the end of the meeting.
I just want to let you know, I'm looking forward to working with all the folks in Southwick. I've been called to cover this Fanian trial, and it's going to keep me busy doing that for the next couple of weeks. So I really can't get in it. So that's it, and I'll mute now.
What trial?
Okay,
Thank you.
thank you.
What trial?
It's the Westfield police officer accused of killing his wife.
Oh, okay. All that. Okay. go
Right.
ahead.
Southwick, so basically been handing out literature and events to the food pantry for distribution to their clientele. On February 8th at the library, I had a plant-based eating presentation that, we had a great turnout. There was over 15 people there. And that's all they wanted was 15, the two people that did the presentation.
Was that with Andrea Bugby?
Yeah. Yeah, it was great. They did a really good job. They actually gave out samples and spotlighted a few of the cookbooks, so people were interested. It was good. And I do meetings with the food pantry every month, and that's been going well. Elms is still working with the senior center here. So on the 1st of February, they did a falls presentation. On the 8th, they did a nutrition. On the 15th, they did specialty diets. 22nd impacts of screen time on eye development for computers. And they're still going. They'll be on vacation next week and then they'll continue through the end of April.
Can I ask questions while you do your report?
Yeah, sure.
Okay. So the food pantry, when you have meetings with them, what do you usually discuss? What are the-
What's going on? So it's like a board of directors meeting. So they asked me to be on their board of directors and, just what's going on in the pantry. They're trying to get a grant. It was actually an article about it in the newspaper. They're trying to get a grant from Southwick, so through Southwick to build a new pantry, I believe.
Oh, nice.
Yeah.
And now, I'm sorry,
Yeah, go ahead.
the location, is it still by the church?
They are still by the church in that little.
Little white
That
house
little-
next to
yep.
that, yeah, okay.
I think it's through the cultural. They somehow the town pays, I think, some of that, or I'm not sure how it works, but they're trying to get in, they need a new space.
So they're
Yeah.
they're
Too
not
small.
downstairs in the church anymore. They're over. in that
They
other
have,
building.
they have both levels. They have, the supplies are in the basement, but they're not in the church. They're in that
They're-
little house next to it.
Oh, the
Yeah,
house,
that
not the building,
No.
not that long building.
No, no. I think that's where they were going to go, but even that space is too small, so I believe they're trying to get a grant to get a new building.
Okay.
Yeah, yeah, Joe Didi was asking me about that. I think they're planning to use some of the existing space, but add like a warehouse. So then I think I think now their offices are upstairs, so they would move their offices to the first floor and then have like a warehouse off the back of the building that they'd be able to keep all the food and everything, so.
So that little white house is
Will
still
eventually-
open to the public for
Oh,
getting,
yeah, for getting food to go there, yes.
Yes.
Is that to the right or
absolutely.
the left of it?
If you're looking at the church, it's on the right.
yeah,
So
If
on
you're
the McDonald-
facing-
on McDonald's side.
Yes.
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 Okay.
I think it has,
facing east.
yeah, it's
Yeah.
like a little front door you walk in and there's a ramp in it.
Do you know east?
South,
No, south is that. one.
yeah, it's south. The church is south.
Okay,
Okay,
All right, and then, I have blood pressure appointments here when I'm here on my days, so.
yeah, so how's that working out?
It's good, it's working out good with the 2 chairs and I don't have too many, so, right now. And then just we're starting, to promote health fair that we're doing. in
Because
May.
it's with blood pressures and we're following that standing order. That's the one that
Yes,
the doctor
yes,
had looked at.
Yes, yes.
Yeah, everyone beat it to death. We beat it to death.
So the health fair we're going to do on May 17th, the Wednesday. And we created flyers, Chris and I, or Chris created the flyer to distribute to find vendors and so forth.
Now, did you run it through Carl?
Yep, he approved
He
it.
approved it.
Mhm. Yeah,
and where's it gonna be held?
Here in the auditorium,
Okay, what day? Did you say?
Wednesday, May 17th.
You have the flyer already prepared?
Yes,
Will you send it to, channel 15,
sure.
public access, so that
Oh,
way
good,
that would be
yeah.
another means of advertising.
It's Jim Middleton.
No,
Okay.
no, that's, Strimsky,
Ken
Ken.
Ken
How do we
Stumpf.
send it? Is he in the mail? Is he in our?
Yeah,
Time.
it just put channel 15,
Okay.
and it'll go right to him,
Okay,
and then he'll post that on the,
oh, wonderful.
I thought it would be good to put it on the Facebook page too, the town Facebook page.
Yeah.
You know, just
and the Board of Health,
Website.
website
Website. Okay.
also.
I don't know how we do that.
That's-
Well, if you have
Yeah,
to fly or. if you
yeah.
can
Yeah.
to Jim,
Jim.
Okay.
Jim will do it.
Yeah.
All right.
Okay.
And what will the hours be, do you know?
9:30 to 3:30. And that way the vendors take down after that and hopefully by 4:30, everybody's. Not too much over.
I don't know, it'll be,
You know. See how. it
I'll
goes.
try it.
so you'll know for next time.
On Tolland, I do the coffee hour with the seniors and I'm going to Tolland mostly every month. But I don't get anybody, so Tom and I will discuss what the future of that will be. And the same kind of with Granville, I go there, alternating schedules, but I don't see anybody. No.
At least you're going and
Yeah.
present.
At the library in Granville, we're doing presentations this month. The Alzheimer's Association is supposed to do a presentation on March 23rd. But they have a minimum audience that we have to reach, so
What's the minimum?
15.
Yeah.
But we've posted it everywhere, so I'm hoping that will,
Yeah, I have it in my town.
because it's a
paper.
really good,
So do they call first to let you know they're going? So
yeah, they're calling the Granville Library.
So is that something, is that channel 15 go up there?
It could do that. No, it's for Southwick,
Yeah.
but
People from here might go.
But every once in a while,
Yeah.
but other, but you
not only that, but, surrounding towns may,
Get it?
may look at it too.
Okay.
And it could be a word of mouth thing, yeah,
Right.
so
Okay.
any public
Okay.
announcement like that,
Yeah.
just
Yeah.
channel 15.
Okay.
Send it over, okay?
Yeah, because you see other stuff in there for West Springfield sometimes.
Yeah, and some Westfield,
Yeah. so-
they have like a Polish
Yeah,
day and
okay,
dance or music or something, yeah, so
Great,
they,
great.
and they have movies, Godzilla movies.
Oh,
okay.
yeah.
Oh,
Perfect.
nice.
So, it's not strictly just,
Right.
reading,
Yeah.
Okay,
so, yeah.
Great.
and then Highland Valley Elder Services, they're the elder service area that, takes care of our town, so they're doing a presentation in Granville on March 6th at the library, so hopefully we get people to go to that. They advertise everywhere, and they've advertised it in the Country Caller up there, and I think he even put it on his TV station, whatever it is up in Granville, so.
And you can advertise it, so.
Yeah.
Oh, yeah.
For Southwick too. And as far as communicables, in Southwick, I had a Pepsi in February. A 2-line, and I have a new one that I'm currently investigating, the crypto, but I haven't talked to the person yet. And,
And it's spinal fluid.
I think it was, blood, yeah.
Oh, okay.
And COVID 21. In Southwick, Granville had 2 and Tolland has 1.
Okay, out of the 21, do you have like the death ratio or something, or just the cases?
I didn't get the report from that Mary Thomas who breaks it down yet for February. There's always a delay,
Okay,
but that report does break it down.
okay,
So
Nice.
when they get it, I can probably bring it to the next meeting because
Right.
we're always like a week behind.
Yeah.
Takes their time to,
So when you get the report, you'll have Jim put the new one in.
yeah. Yeah,
Thank you.
so the January one's on our website now. Now when they get to February, I'll post it, but yeah, she does a really good breakdown
okay.
by ages, by all that.
Hmm.
And how is that in relationship to Hampden County in general?
Oh, we're lower than, in your big cities. I mean, it's definitely changed. You can see the drop in it after the holidays, always. There's, even with flu, we had a ton of flu, and now you're not seeing it, so.
Okay.
There's definitely a decrease.
Okay,
And we did get more COVID tests, yesterday, only because Southwick, the residents are taking them. So we figured since they're dropping them, the COVID Biden administration is stopping it in May, that why not get them while they're still free for the people, so we're still giving them out.
You're good till you said August.
These are good till August, yeah.
And that's the posted date, so it's really, they have extra 6 months,
Yeah.
so. So they're good till probably February, so,
And the library gives them out and people really take.
Yeah.
She's always looking for more,
Yeah.
so I gave her $6.
well,
I did take,
Yeah,
I took those boxes out there.
Oh, good.
Today.
perfect.
Good.
Right.
Is that it?
That's it.
Yes.
All right, Russell, I have Elms College facilitated a sleep presentation. I have nurse hours at the Council on Aging. It's kind of hit or miss. I do it on the day that they have, Meals on Wheels comes twice a week, and so I do it on one of the days that they're there. But if the weather's not good, nobody comes. But trying anyway, so, I
And
have.
Russell's the bigger town, isn't it?
Yes.
It's Lansford.
And they have a nice paper that goes to all the residents, and it's the Council on Aging, the library, and everything happening on the town hall. So I have a little space in there, and my hours are posted, and if we're doing anything special, that's on, my little health information was cut last month because of room, but at least my hours made it. Let's see, and on Maven, they had 2 COVID cases. I also met with the library about doing caregiver presentation, probably maybe with the students. We'll see how that goes. She doesn't have a lot of traffic during the week, only on Saturdays, really, so. Blandford, I met with Jennifer on 210 to create a plan for my time. And we came up with a nice little plan of what I'm gonna do and where, and
It's quite a plan.
it is quite a plan. So I'm gonna do nurse hours twice a month at the Council on Aging to coordinate with the lunch and breakfast that they serve, and then twice a month at the exercise class on Mondays. So I just meet with them and do blood pressures. I had 2 people sign up for the foot care clinic so far. And I just have a health information table outside the Board of Health, and then I have one at the Council on Aging. And I'm also gonna have one at the library starting next month.
So who's gonna do the foot care? You have to,
I have a nurse that will do it, but she needs 6. So, but I think we can get 6. I'm working on it. I'm hoping we can get 6. I have, in Montgomery, I have 5. So that's pretty good.
That's really good.
Yeah, so Blandford had 3 COVID cases. So Montgomery, I have office hours on Tuesday. I have a place in their little town paper too, and that goes to all the residents in the town. I attended the grill just to pass out business cards and to see if anybody had interest in the foot care clinic. And I also gave them all my little hours, a little sheet with my hours on it. And I had a resident who offered to help me with contacting the seniors about hosting a coffee hour at the Council on Aging, because it has not been open since before COVID. And there used to be a lot of attendance. So I'm trying to get that going, but I don't have keys yet. It makes it a little hard. And there was only 1 COVID case there, and Elms College did wellness presentations for Russell, Southwick, and Westfield. And I did a presentation in Granville and in Tolland on seasonal affective disorder. And then we just spoke to several businesses on the fair. That's it for me.
so you're trying to get businesses not just from these towns, but from like Westfield, West Springfield.
Yeah, neighboring towns. I thought even like Feeding Hills, I went up to 57 the other day, and it's like that little thing where, the intersection there.
There's a
Little-
little place.
So is there like a minimum of vendors you wanna get?
They said that we could fit 30. I think we have 11? We have 11 right now. Confirmed, so
Good.
we still have. So.
And then what will we need? Will they bring their tables or? do we
Nope.
provide
No, they're
them?
gonna set up tables for them,
We have the
6-foot
We have the
tables.
tables, okay.
tables
And chairs.
with the electricity.
And then we're gonna have a table for the people that can't make it. If they wanna give us a flyer, we'll just have like a flyer table.
Good.
So we'll
Nice.
see. We'll see how it goes.
Yeah.
And police will do a drug take back day that day, so we'll have to put some.
Drug take back and meet.
Yeah. Yeah.
Yeah, good.
That's gonna be great.
Hope it works out.
Yes.
So do we have anything else?
No, I'm impressed. You girls seem to be, working it up really good.
Yeah. doing a good job.
Especially trying to get as much of the public involved as
Yeah.
possible. And that's what
Trying,
you need
working at it.
after 2 years of
Yes.
isolation.
Yes.
Right.
So,
Yeah,
no, it's this,
absolutely.
and you
It's
know,
moving.
even if you don't get as much participation
Mhm.
Mhm.
on the first try,
Right.
the
Right.
second, the
Yep,
third,
right.
word of mouth.
Mhm.
So, you know, it'll work out.
Well, that's why I say to Granville, I'm like, let's just keep doing it because it is winter.
Yeah,
And You know,
yeah,
and many
and
people
even
do
Tyler.
travel or go down south and they come up, whatever.
and even Talon, their population doubles in the summer,
Yes,
right?
yeah.
So.
So,
Yeah.
we'll
No,
see.
I'm impressed. I'm happy with you ladies.
Thank you.
you wanna do the PAG grant? before we
Yeah,
leave?
so,
Yeah, sure.
you had that, meeting.
Yes, so it was the CART meeting, which was capacity assessment response. I don't remember the whole acronym, but basically it was the results of all 6 towns had to do these surveys back in August and September. And it was basically what your current capacity is, what staff you have, what equipment you have to be able to do any nursing functions or inspectional functions and all that. And the intent was to identify any needs. So
Did all the towns do it?
yes,
Good.
yeah, yeah. So I think there was some issues with, they wanted some of the backup documentation, like if you said you did a, housing inspection, they would want a sample of one of the housing inspections that you've done in the past, however long. So I think some of the towns might still need to do a little bit of that, which was part of the thing the state wanted us to do. The biggest recommendation was be able to address communicable diseases and nursing, which we obviously have.
So is this just more than just nursing?
Yes,
Oh, it
yep,
was.
yep. So this is for the Public Health Excellence Grant. We primarily use it for nursing, but it can be used
Oh,
for
okay.
inspectional stuff as well. Or anything else that, we need as health departments. So, or boards of health, I guess most of the towns don't really have a health department per se, but so the biggest need identified was nursing, which these guys started in October. So we had already addressed that. So there's a way we can go back and modify the reporting, and then that will address more accurately what our needs are now, because we already took care of that one. So we're probably going to be getting more money in next year's budget for the grant. I think they want to give us at least 300,000 compared to the 180 that we got the last time. They strongly recommended getting a full-time shared service coordinator. So that would kind of take over some of the stuff that I'm doing for the grant, and would be able to help all the towns with, any grant related stuff, as well as maybe even grant writing for other grants that, would be helpful for the towns. And there was some need for inspectional stuff in the towns. So we're gonna, a few of the towns couldn't make it to the CART meeting, even though it was technically mandatory. So I'm gonna, since there's been so much turnover in my position, since the grant started. So we've kind of been disjointed. So I'm gonna try and get the towns together, just to have a, meeting with the town so we can determine, because I feel like lately, Southwick is the lead agency, but I don't want us to be making decisions arbitrarily for the whole group. I think it should be
So I was on that meeting, but what other towns are on it? I didn't know. Other than you.
there was Russell couldn't make it. I was technically there for Montgomery. And Tolland was, I think Tolland. No, I think it was just me, actually.
Was Tom?
No,
Tom
Tom had a family thing last minute, so he couldn't go.
So was Blanford there?
No, Blanford wasn't there. Russell wasn't there.
So you're,
So yeah, it was just us, really.
Mhm, we were on there.
yeah, you guys are there.
Yeah, so,
I was Emily.
yeah.
Oh,
Oh,
yeah,
Emily?
Yeah.
Yeah.
That's
That's
right.
her,
Yeah.
Might really is.
So yeah, I'm gonna try and get that started back up of, at least start the conversation of what else we can do with the grant. We could get inspection software so that we can do inspections and have our reports automatically generated on iPads and email them out to the restaurants instead of writing it down.
But it would have to be for all 6 towns,
Yep.
not just.
Yep.
us.
So, and it could be paid for. They want to give us even more money than we currently got, and we are having a hard time spending it. So,
The problem with those programs is you have to make sure that the future grants include the maintenance
right,
and upgrades.
right,
Yeah,
Because it's not gonna do you any good to get the program and.
right.
No.
You know,
Yeah,
every other month they change
Right.
something on them.
There was one I was looking at, and I actually talked to someone from the company, and they, it's a Massachusetts-based company. So they have close ties with DPH, and they actually have a program that is designed for the PHE grants.
Okay.
Because there's some of the requirements of the grant is like, you can't use funding for a contract that goes longer than the term of the grant.
which is
So,
1 year.
so they're, they structure
Yeah.
the contract to fit for the PHE grant. So that's something we can look into if all the towns are interested. We could look into doing like a shared inspector for the towns and, use it. We might not need to use it in Southwick, but if I was going to be off for a week, we could have the shared inspector cover it, or if any of the towns don't have an inspector, but they have one restaurant, they can. So there's different ways we could have someone that's, 20 hours a week, or someone that just bills, as needed for
Per
inspections,
diem.
per diem sort of thing. So,
When do you have to reapply by? What's the
the,
deadline?
I don't think we technically have to reapply. I think it's automatic sort of thing. So we do have to revise our budget for fiscal 24. That was due in the end of April. So I think that would be the closest thing to an application, but
And also there'll be increases for our nurse too.
yeah, we can budget that in because they want to give us more money. So I don't think that should be an issue. And
No, we don't get an increase.
yeah,
I took that away. so-
Yeah,
A thought, which I talked to Tom about before, is the big ask that Chris and I had when we first started was like visiting nurse. And that's what our towns all lack, so
Right.
possibly we could contract, if the DPH allows it, with the VNA to say. We'll give you this much money a year, and you have to guarantee us that someone will go to these towns. Cause that's what doesn't happen.
or maybe even just like a bonus program,
Something,
so that
that was
when they
their.
would have to go up
that's-
there. I mean, cause that's why they can't get
ask, you
help.
know, that
Right.
they're not getting the services.
And it's because they don't have the people.
Right,
Yeah.
so even if we give them money, I don't know, if they don't have the staff, they don't have the staff, but maybe if there's like an incentive.
Yeah, that's
Right.
like a bonus.
Or if we
program.
contract with someone, you have to guarantee that.
Right.
You're gonna cover it, and what do they get, 2 a year maybe? You're not talking Springfield numbers,
right,
Yeah.
probably a small percentage.
right,
They could probably
Yeah.
give us some idea
right,
of how many.
Yeah.
Resource North and Holland would be able to, and then I'm sure Jennifer could.
Yeah,
Right.
'cause she gets the call.
Someone has to have this information.
Right.
With, these, all these, locations for, emergency, my
Like the
husband,
urgent cares or.
yeah, my husband calls them quick loops.
Yeah.
Um,
True.
For those, because they're closing,
Yeah.
yeah,
this may enhance your need,
Right.
because,
And
you know,
nursing
exactly.
homes.
right,
Yep,
yes,
Exactly,
so this is,
you got something else. to do.
yeah,
yeah.
it'll be, an option.
Yeah.
Hopefully, if you can get staffing, that's
Right.
the issue.
But I think the problem with staffing is the money given to the nurses that are going out.
Yeah.
You know, if you tell the nurse, okay, if you go out to Blandford, you're gonna get an extra $100.
Mm.
Might be an
That's,
incentive.
yeah,
right,
Yep.
because it's the mile, you don't get paid while you're driving.
Yeah.
Mm.
You know, so you get paid by the visit usually when you do home care,
right,
and, I mean,
Yeah,
right. Yeah,
Well, and I think it's because winter time people are afraid to travel in bad weather and, you know, I mean, there could be a lot of
Especially
different
in the hill
things.
towns.
and
Right.
rural towns are tough,
yeah,
Yeah.
yeah,
But maybe we can find some agency.
And maybe we can go to like, the nursing board and see if there are nurses up that live in those areas, you
Right,
know what I
that
mean?
might-
I mean, then it's not a trip for them,
Right, right.
Right.
Yeah, we start recruiting, right, so can you work for us?
Yeah,
I mean, not even us, if we got them to work for an agency,
right.
so that we don't have to worry about the medical director.
So the elder services, that's different from the VNA.
Yes.
Yes.
Yeah. that's more, Highland Valley's more of like a, social services agency, so they would help someone. If they needed a VNA, they would help someone find a VNA
Right.
sort of thing.
And
Or
they said
find
they have
any other,
homemakers and home
Yeah,
health aides.
yeah,
But they do not have nurses. Well, they have a nurse that will go out and do an assessment to see if,
Yes,
You
they
needed nursing
qualify
care?
for service.
Right.
Yeah.
That's what they send them out for. So
Right.
these are the people that are on the like the Medicaids.
Mhm.
And a nurse will go out to see what you're entitled to. So do you need personal care? Do you need someone to help you with your, needs, your personal needs, shower, bathing, things like that? Can they step into the tub?
Mhm.
Can they feed themselves? Can they cook dinner? Things like
Mhm.
that. That's what the nurse does. Just to see what they would qualify for under the insurance.
But now, even though they qualify, they have no staff to do it. So,
So it's like there's CNAs that you go out to the homes if they feel they qualify, but.
Yes, I'm just familiar with VNA, like you come out of the hospital.
Right,
yeah.
You
so
can
the
work with
hospital is
them.
supposed to set up services for anyone that's discharged from a hospital. The hospital, the case manager has to set up services if they're saying they need VNA, a visiting nurse. So maybe for a wound care, a dressing, some kind of, ostomy or something. Or a diabetic, someone newly diagnosed, they'll send a nurse out to teach this person what to do.
Mhm.
The hospital, if they're discharged from a hospital has to set that up. So that's but I think Holland is going back to the days of COVID and when things were a mess. And 2 years ago, they sent someone home. They probably didn't have anybody then. But I think as we're going further, I think it's, it has to be getting better now. And so hospitals are discharging, but they're setting up the VNAs now. So I don't think it's gonna be as much of a problem, but at least if we could contract with someone and say,
So,
guarantee us.
so for the health fair, can you get a VNA booth and a elder service booth?
Well,
They
they're
probably
coming,
have a
right?
person.
Yeah, the
Highland Valley will
Highland
be
Valley's
there.
coming, yeah.
So they'll go
They're
over,
interested.
they have a lot of programs.
They have a lot of
so
programs,
many
but they don't have
programs.
people to go up there,
Right.
so, I mean, it's almost like crazy having them assess, because that's where it stops.
Right.
So I don't know, I think a workaround, a creative workaround where we find our people and drag them in,
Right.
I mean,
So so the towns together have to think of ideas how to spend this money.
Mhm.
so that's something that's. A great idea. It's a little unconventional compared to what most public health agencies do in the state, so I'm gonna find out if that's something we can spend the money on, hopefully it is. Because that's really one of the bigger needs in our towns, so.
So we would, allot so much money
Yeah.
toward that program and then
Yeah.
do something else with.
create a budget.
Yeah.
Yeah,
Yep.
create a budget and do it something, which is what they want, right?
Right,
Okay.
right.
So you're gonna work on that?
Yep.
Okay.
Yep.
All right, anything else with the grant?
I don't think so.
No.
Just, I met with DPH a few times. Separately from that, so. Then it's been very time consuming, but I think I'm. Finally. Getting a hang of it, and one of the line items in the budget, Laura didn't have an account for. So I'm having her set that up so we can order some printer ink and things like that, for the printers that we have. So that's moving in the right direction. Hopefully, once now that I've got a better feel for it, it won't be as time consuming. But if it continues to be this time consuming, then I would definitely understand why they're recommending getting the shared service coordinator, because it's a lot, so.
Mhm.
The other thought that I had, you're looking for a secretary for the Board of Health. Is it possible to hire someone and they would wear two hats, maybe be a part-time coordinator? And then some money would pay them out of the grant and some money would pay them out of but then I don't know how it would work as far as them.
Right,
because Probably not.
Well,
yeah,
there's like the Council on Aging in Russell. She works for the council for 15 hours.
Right.
And then she works for the town hall for 4 hours. But she doesn't get any benefits.
Right, because she's
Right.
under that,
She's still
Yeah.
under 20, but
yeah, that could be,
unless you wait 24 hours. As the public health grant, and then they would get part-time benefits from each 24 hours.
right,
Public health grant,
right,
and then whatever hours. To do the Board of Health stuff.
right, yeah,
Maybe it would be more appetizing to a person who'd rather full-time work or close to full-time than.
right. Yeah,
Board of
yeah,
Health
that could get
secretary.
complicated, but it's definitely worth looking into. Yeah.
Because we don't really have the space to add
hmm.
2 people to the office.
Yeah.
Another-
I know some of the other shared service coordinators across the state, and I think a lot of them are just remote.
Yeah.
So they wouldn't necessarily need
Mhm.
a desk,
Yeah.
you know,
That's how they'd have to be.
and they would probably operate like you guys to some extent, where, you know, one day they might go up to,
Mhm.
you know,
But
come
the
here,
shared
go to,
service coordinator would be your administrator.
Right.
right,
So- I know, but the way the budget is and the contract is.
right,
so-
yeah. Yeah, so we'll see how that plays out, but
Okay, so look at, a doctor. Yes, I'm interested in helping out. Bay State does not require me to go through them. I have to sit down with the agreement and spend some time looking over it. I think this LOA, what's that letter? It's LOA.
Letter of agreement.
Letter of agreement is the same one as the original with Bay State, except that the name has been taken out. If so, there may be parts that don't apply to the individual, and I just take those out. Also, is there a section for payment? Is there reimbursement for this position? And thank you for your patience. So I just have to, and in that contract, it does have a thing for payment.
Yeah.
which is what, like,
Is that Dr. Wall?
one,
That's it.
who lives in Southwood.
Perfect.
nice,
So,
And that will be for all the towns.
well, if he's he's gonna do the standing order, he'll sign the standing
For all the
orders for all the towns.
Oh, great, great.
Now, I'm not quite sure that standing order. Is there one, say blood pressure? Is it gonna cover all the towns, or is it gonna be just for one town? Cause does he have to sign 6 standing orders for?
I would put them all on one.
yeah,
Yeah,
I think
that
put-
you could put them all
yeah.
on as the
Actually,
regional,
Put them all out.
Right.
regional public.
Yeah.
health, Right.
yeah, we could probably put them all on one, and then maybe just as a formality to cover ourselves, send them all to each Board of Health and ask them to vote to accept them.
Hmm.
And if they don't accept them, then we won't do any of the stuff in that
Yeah.
approved stuff in your town.
The other thing is I have to look to see, cause I think I have all on PDFs.
Oh, okay,
So ask Jim to do a conversion.
I must see if I have, if Alex has my word.
Yeah,
Cause even when you convert it, you still have to go and fix it.
Yeah.
well, you're gonna have to fix it anyways,
Right.
because it's not going to be
Yeah,
specific
Right.
to that.
I'll have to go back and I'll see if Alex has.
Jim, I think tomorrow Jim is going to set it up so I can access Tammy and Alex and Tom's old files.
Okay.
So once that finally happens, I will look and see if they're in there in Alex's files.
Perfect.
But he was so remote all the time. I don't, maybe he did it on, his own computer or something, and it might not be on the town computer, so.
I also got an email from Full Circle Technology for e-permitting software, which is gonna be on the back burner because that was like outrageously expensive.
Mhm.
Yep.
Well, Tom will be working, hopefully with the grant
Right.
Right.
to
Yeah.
maybe purchase that type
Well,
of stuff.
the grants, we could probably look into permitting software as well. But the grant software I was looking at was exclusively just for inspectional.
Oh,
And so just your
inspection,
inspection
okay.
reports. So
Okay,
I figured for the grant, that might almost be better. Then each town could keep their licensing or permitting how they currently do it, and it wouldn't be a big change for everyone. But we could look into that, doing it as all in one sort of deal.
And that doesn't tie in with the building department's software.
That Full Circle one is what building uses, but
That's what e-permitting.
Yeah.
We would do inspection.
Yeah.
software.
yeah. So
well, it would be easier if our town was connected,
right,
but that wouldn't necessarily mean all the others,
right.
Yeah.
you
it has to keep
because
that.
they would have possibly their own,
Right,
so.
right. And some of the towns like Montgomery has like 3 licenses,
Yeah.
probably, so that wouldn't be a huge benefit to them. I'm sure, Granville, Holland,
Granville, does Granville have?
they probably have,
store.
they probably have a few food ones, but not a
The
ton.
only thing I can think of is the country store.
Yeah.
There's no other.
Like those
Oh,
apple places?
The Granville Scoop.
Oh, that's
Oh,
right.
Yeah.
the grandma
Yeah.
makes That one.
Did the apple place?
And the apple, yeah, what about
they
the
have to be-
orchards and stuff?
It's a-
Like a
if-
farm.
If they
That's a
just do. If they just do like the apples, then they're exempt because it's agriculture, but if some of the farms will make like apple pie and stuff like that, and that they would need a
Jams,
license for.
jellies.
Oh,
Yeah. Okay.
So it
Yeah.
could be either way.
Yes, Talon has a store.
it's
Closed.
closed right now. They don't know if it's gonna reopen.
Oh, well,
Oh.
Yeah.
It's the only one they have.
Oh,
They have
no,
They
yeah,
have a
And it was
restaurant.
just a summer store, right?
Yeah.
I don't think it was open. in the
Do they have
winter.
a restaurant at all up there in Talon?
No,
Mhm.
all my towns have a restaurant.
A restaurant. Talon does have a restaurant.
No,
No.
my
Heard.
3 towns,
They have
Montgomery,
Montgomery.
Blanford and Russell.
They
have
have a restaurant.
Restaurants, yeah.
there's a Russell Pizza place near the state police.
yeah,
Yeah,
Russell Inn.
and Russell Inn,
Russell Inn.
yeah,
yeah,
yeah.
it is.
Okay, we've
Right.
digressed.
Okay,
Yep.
so.
We can't
We-
keep these ladies all
Thank
night.
you very much.
Thanks,
Thank
have a
you.
great night.
You
You
too.
as well.
Yeah.
Take care. See you later.
Have a good night.
So. The secretary's position,
Yes,
I may have somebody that could be interested in,
okay,
but nothing, it's going to
Nothing
be for a
concrete.
while.
okay,
No, nothing concrete
Yeah.
nor immediate.
yeah, okay,
So, Sue and I. I mentioned to Sue and, she's comfortable with at least, not for now, doing the minutes and,
okay,
yeah.
yeah,
So we'll, I'm not sure. Hey, by the way, type thing,
right,
and has to look into,
okay.
what it would be.
Yeah, okay, so yeah, so in the, you said you couldn't go to the select board for a while. I'm willing to go, if you guys don't mind, I'm willing to go. I'll talk to Carl tomorrow and see when he can get me in, and I can go and ask them. I think we just needed like $800 more, I think, to be able to offer $16.35 an hour. Another thing, I wanted to see what you guys thought. If we're going to the select board anyway, to see if they would give us even more to up the hours. Do you think there's a need for that? See if we can go, they probably wouldn't want to go beyond the 19 hours. They want to keep it
Do you
part-time.
think you would need somebody there for that many hours?
I think it would help. I don't know, like, I've only been here a month, so I don't know the,
Mm.
busy times and slow times, but definitely it would be. I think it would be nice to have a little extra to do, all the POs and all that stuff and licenses and, right.
Karen does it though,
right,
Karen does it for the Board of Health.
yeah.
some of the stuff she'll do,
So her position,
yeah,
you have to ask Carl about that because she was shared
yeah,
supposedly between the building inspector and the Board of Health.
yeah,
However, you know that the percentage of the share is like 98-2.
yeah.
But her budget.
I
comes out
I
of
think we
building.
get more than two probably, but yeah, it's
Yeah.
yeah, yeah. When
Not
I started,
50-50.
Tom said it, her primary role is building.
Right.
And then,
Right.
if she has any extra time, that's what we get.
So prior to saying, can you think about a 19 an hour a week secretary?
Yeah,
Find out, what her duties should be
yeah,
and compare them to what they actually are
mhm,
to see if Karen is fulfilling
yeah,
what they think she is doing
right,
versus what she's actually doing.
right, okay,
So,
all right,
Um. Also, come summer and stuff, I don't really think there's
Yeah.
much to do.
right,
The busiest time is getting the
Is-
permits and
yeah.
getting the money in.
yeah,
And another bit, there was more money in that tray.
yes,
see that.
yeah, yeah, I saw that, I got it,
Yeah.
Tom's been doing the turnovers.
Yeah.
the Board of Health sometimes reduce their meetings to one
One.
day a month too during the
Okay.
summer.
yeah. Yeah, that was actually one thing I wanted to ask about as well. Because I could see if I was, only doing a 10-hour position and having to give up 2 nights a month. I was curious if that was ever a consideration, was to switch to doing just one meeting a month. That might be a little more desirable to a part-time person to not have to do 2 night meetings. I mean, I know we're all used to it, but
That will be a discussion between the new board.
the new boards, okay,
Okay,
yeah,
because right now, 2 members
right,
should not make a decision
yeah, fair enough,
for those 3.
Right.
Okay,
yep,
And it's 10 hours a week.
right,
And you only meet every other week.
right,
So minutes are the big thing, except for,
Mm.
unless we get, we used to, the secretary used to go through the, real estate.
yes, town
list
Wow.
did too,
To
to
see.
see if
Yeah.
the Title Fives were done.
Yeah.
Files Were done.
Uh,
And that was one thing they did. which
wow,
was good.
I've never heard of a town that had the time to do that,
Well,
Oh, our secretary did.
yeah, wow,
Tom did it too.
yeah,
So, but
I mean, it wasn't, it's not that hard, you just.
Yeah,
See if
pick
they
up the
submitted
paper,
one,
yeah.
And then there's a form letter they sent out.
Yeah.
If they didn't.
Wow.
And also Tom, I don't know how you're gonna do, it, but Tom typed a lot of his letters.
Yeah.
Yeah.
I don't know if he had the forms and he just filled them in.
Yeah.
I'm not quite sure how you wanna do it.
yeah, Yeah.
there's no dictation anymore.
right,
If you're going to say it, you might as well just type it,
right, yeah,
I
Yeah.
mean, the filing that's not,
Right.
under your purview,
Right.
obviously. And, mailing things.
Right.
And the turnovers, purchase orders,
yeah,
that could be secretarial.
yeah,
So.
Yeah.
But I don't think the turnovers, what do you get checks for the restaurants,
Right,
that's it.
right.
Once that's done, there's no more turnovers.
right,
Purchase orders, how often do you
sure,
ask for a purchase order?
right,
Could you, ask Karen to buy us some banker boxes?
Yeah.
The only thing is we only need like one. What if we need like one banker box, No, okay, we maybe a couple, so
Why would you need a couple banker boxes?
just store all the, septic permits that these septic is on sewer. we need to put.
Oh,
file those-
storage boxes.
Yeah,
Oh.
Yeah.
we call them
they-
Baker boxes.
Oh,
Yeah, it's the brand.
I'm thinking of little box
No.
that holds money.
No,
No.
You know? what I mean?
So- So I pulled a half of them so far. I've got 4 more cabinets to go through. But then I was telling Tom, you know what, I need to go back through to see, because some of them might be on. Well,
Right.
Yeah,
so I have to see if there's any.
so you
water
have to get a list of who's on water, on public water.
What?
And public sewer.
I
And
got, I
that
got the
would,
public sewer from you.
right, but now you need a separate list for public water.
And who I get that from?
Christine Mayette in DPW.
Christine Mayette.
I can see if I can get you a list through the state. It's probably not exhaustive. I'm sure there's some that have been missed, but the state digitized all their, because for years and years they've always been sent the well completion reports. And they've gone back and digitized all of them. So I can go on the state portal and get the state's list of all of the private wells they're aware of that are in Southwick. So
They're just aware of them. They don't.
yeah, I think it's pretty close to, probably having most of them. They go pretty far back. Some, the old ones used to be the tiny little carbon copy sheet, and some poor soul that worked for DEP had to go through all of those and type them up and put them in a spreadsheet. But I used that in Westfield a few times when we had to send out some well notices. So that would be another
Well.
way to cross-reference.
And Christine would have the list in Southwick because they send out the billing.
Right.
So
Right.
it would be.
Yeah.
No, so if I have
One
that,
and the
then I
same.
could just pull the ones that.
Yeah.
I pulled
Right.
to see. I think,
Right.
I think a lot of them down by the lakes, isn't there a lot water connections down there, a lot of them?
Mm,
No, okay.
Yeah.
I'll find out before I box them up and
Yeah.
store them somewhere.
Yeah.
Which brings me to the thing where Tom is going to get look at the record retentions. I was looking at Michelle's copy. And like water sampling, do we need to keep that from 2003, from 20 years ago? I mean, it'd be nice to see what it was back then and then what it is now, but do I need to keep all those folders? And the same with all the permits and applications. We keep a copy of every permit that we give out for a permit. How long do we
Okay.
keep those for?
You can keep them forever. If you digitize them. That's all you have to do is scan them.
Mhm.
And then save them on a thumb drive. Or save them on a shared file or
Right.
something. So it would just be a matter of scanning the documents and then putting it in a file someplace. And then this piece of paper is no longer necessary.
Right.
But do you even need to do that? Just how many years do you need to go back? and
Yeah.
say?
Yeah,
Right.
they have a pretty good list, so I'll pull that up and
Yeah.
Because we
let you know.
save the application, which is fine. We also save a copy of the permit. So is it necessary to save a copy of the permit if you indicate on the application that you submitted a permit?
Yeah,
Right.
it's just a matter of semantics.
Yeah,
If you want, do you want a piece of paper? No. Okay, save this piece of paper in some kind of digital format. Or store it in some box that 100 years from now, they're gonna say, why did these people say that?
So somebody needs to, does ours scan?
Yeah.
To
Yeah.
email?
yeah,
You'd have to have somebody
Right,
log in and just
yeah,
feed in
yeah,
drawer after drawer. after
that's
drawer
what
after
they did
drawer.
with the plans in the building department.
yeah,
They're all done digital now. All those files.
Yeah.
And in the future, or the future started like 2 years ago, that's what happened. That's how
Right.
they get their plans now is all
Right.
digital.
right.
So another thing too, as I'm going through some old files from 1959. Old. The paper and stuff and carbon
Mhm.
copies and mimeographed and all. I mean, I probably want to keep those only because they're so old.
Why?
I don't know, just reading them is interesting,
Mm.
the reports up to the doctors. lot of reports to the doctor, you have scarlet fever, this person has this person has that. Letters to, the old, school nurse that's long gone by now, and just, complaints, a lot of dog bites,
Hmm.
dog poisonings. Just interesting stuff, and you hate
Yeah.
to get rid of it, because it's.
Make a book out of it and publish it, I mean,
No, I don't
Yeah.
know, should I contact our historical committee, not the society? Do they want any of that?
Yeah. You
The only
could,
thing is, patient record, they didn't have HIPAA back then,
right,
so does HIPAA apply now to something back from 1959?
yeah, that'd be worth just looking into that.
You get too much time on your hands, so.
No, I don't. And
Okay.
So I was reading, it's like one is addressed to Dr. Logie, I live on Logie Lane, and it's just kind of. And Dr. Kellogg, when Dr. Kellogg was first appointed to the Board of Health and to do the schools and all
Hmm.
the discussion about that. And
Yeah,
Okay,
it's interesting.
I get up at 4 o'clock in the morning, remember that,
All right.
okay?
all right.
All right. So go ahead, Tom.
So finish up with the secretary position. Do you want me to see if I can get into the select board? Next week? Or whenever I can to see if they can give us the,
Yeah.
at
No,
least the
my
800?
meeting starts at 7 o'clock. So if we can get there, they start at 6.
Sometimes,
yeah,
If we can get a meeting, and my meeting's downstairs. In the, I'd have to make sure I get out
Yeah.
and get to the meeting
okay, yeah,
for 7.
yeah, I can go and then if you can't make it, I'll ask them and. We can go
So
from
we
there.
just want to basically ask them what they can provide for hourly wage
Right,
for our secretary.
right. Yeah, okay,
And I think we should maybe just stay with the 10 hours, because you don't know what you're gonna need.
right, right.
for now,
Yeah, yeah, I'll probably tell, I won't, I'll see if I can gauge their ability if we wanted to up the hours. But I will only formally ask for the slight increase to get the hourly wage up a little bit.
Yeah, and we don't know yet how many hours we're gonna need, because we have a full-time health inspector now, we never did before.
Right,
I mean, we haven't had, I mean, Cindy wasn't with us long, and then Dee wasn't with us, and LP was, so we don't really know
right,
10
Yeah.
hours a week.
but then let's go back and reiterate. You have Karen,
right,
what portion of her job
right,
is secretary to the Board of Health?
right.
I
Okay.
think she does stuff with the installers. and the
Yeah,
disposal
yeah, she does a lot of the
stuff.
septic stuff. She
Yeah.
does all the septic
Yeah.
stuff, so,
So she does do that.
yeah,
Plus she answers all the.
All the
all
phones,
the
yeah.
messages.
yeah. Yeah.
Okay.
All right, so, moving on, septic,
Well,
it's-
we can talk about what to present, okay.
Yep. Yep, septic, we witnessed a couple perk tests, issued a couple COCs for,
Okay. See the perks.
Yep.
662 College Highway,
yep,
repair,
that is new construction, that
New.
is in between the O'Reilly and the Log Cabin Church there. They perked right up in the front towards the road, and they are planning to put in I think they haven't gone to planning board yet, but they're planning to put in a self-storage facility with a small office.
Is that's not gonna be the same one that was Reardon on Industrial Drive?
I don't think so. I think the guy's name was Jim Boyle. He actually, I remember he did one in Westfield, up on Southampton Road a couple years ago. So so that's what they're planning there. Was very high groundwater, but they were able to perk it, and it did pass. It was good. Other than high groundwater, it was
So it's gonna be
really
built
good
up.
sand. So it'll be,
Built up.
yeah, it'll be built up probably to like the same level as the church and O'Reilly on either side of it. So and then Long Yard was a repair. The COCs, 181 College Highway was a tank replacement that I had inspected. I think I told you guys about that one at the last meeting. And then the other ones are all in the greens, and those were ones that Tom had inspected before I started, and we just got all the paperwork, so I issued those and approved a plan for 80 South Long Yard and 32 Noble Steed.
So Noble Steed's new and South Long Yard is repair.
I believe so, yeah. The housing, to Lakemont, Kyle is still, I think Kyle was going there today. So I'm gonna keep that one on my radar. And keep him on a short leash and see if we need to condemn it. Prime Steakhouse, that, I don't remember if that one was open yet as far as when the last meeting was, but I did a walkthrough and it was looking good in there. I was there the day before they did their soft opening.
I
So
don't think it had been inspected.
I heard it was gonna open this weekend.
yeah, I think this weekend is their
Did
grand.
they pay for the permits and
Yep,
everything?
they paid, I issued their permits.
Is
They
that
are,
really how you spell steakhouse?
yes, all of the E's are the number 3 in their name.
No kidding.
Yep. I think they said it was three siblings that own it. So that's why they did the 3s.
Hmm.
I call it, when I called the guy, I think I called it Prime. I wasn't sure how to say it with that. So I called it Prime 3's
Well,
Steakhouse.
I'm thinking of Saint.
Oh, yeah. Yeah.
Okay.
So wait a minute, so you just did a walkthrough, you didn't do an inspection or?
No, yeah, I didn't fill out a form. I just did a like a pre-opening walkthrough, and so I issued the license, and then I like to go back, once they've been running a couple weeks. So
Now, do they have a revised kitchen design, with the sinks and the,
yep, that had all been done
Okay.
prior to me starting. So
okay.
but yeah, it looked pretty good in there. So Xanto, I luckily I did the agenda because I wouldn't have been able to do it Tuesday. So luckily I thought to do it Monday afternoon. Was hoping I'd have time to get to Xanto's. I did go to drop off their catering license, but I didn't have time to do the inspection because I had to do a housing inspection, which came up this week. So that was on a couple houses down 440. Tom had been there before, but it's new owners, so nothing major. Hopefully it should be standard boilerplate, get everything fixed. And
You already went to it?
I just did the inspection this afternoon.
440 housing
Yep, 440 College Highway.
was the issue.
Some of the plumbing fixtures weren't working or were clogged. It's electric baseboard heat, so one of the baseboards in one of the rooms wasn't working right. Light in the bathroom wasn't working. A couple door handles were broken.
Is this tenant man?
Yeah, tenant landlord. So nothing that should be, extremely expensive or difficult to fix. So
440, that's right here.
yeah,
140,
that's
44?
440.
440. Yeah,
It's like
440.
two
or three down. Yeah, yep.
Okay. so
Bottom apartment or,
Second floor, and it's A, B, C, and D. It's
Okay.
2 buildings, so
Yeah.
it's the right building on the second floor. So
okay.
So now, when you do the inspections now, do you just give an inspection form? Do you write a letter? How are you?
I fill out the inspection report, and then I'll write a letter and send it certified to the tenant. Well, send it certified to the landlord, and then send a copy regular mail to the tenant. So that
You have like a form letter?
yeah, the state has a form they provide. So yeah, that was scheduled for Tuesday, so I was hoping to do Xantos today, and then I had to reschedule the housing for today. So I didn't get to Xantos, so they're on here for no reason. Delinquent permits, the only one left is Gristmill. So I'm hoping to go there tomorrow and see, they did their application. We're only waiting on their late fee.
Gristmill is
The
that
Gristmill Cafe.
Oh, cafe, okay.
So I found this book. You know about this book?
I can't read it from here.
Renewal
You-
checklist binder.
Binder. Do you use this at all?
I have seen it, but I haven't updated it with the ones that have.
I'm sorry.
That's all right. I was
I
finished.
think Jessica created that.
Think, what does she have? Permit distributed. The cottages,
Nope, they're good. The only, the Gristmill Cafe.
so, okay, so the cottages are good, we should check that off.
Yeah.
Then the other one is Roma Restaurant,
I think they're good. I'll have to double check because they were waiting for something, but I think I think we got their fee and everything. Maybe it was just waiting for their serve safes. I'll have to double check that one because it wasn't clear in the folder what that one was. What that one was held for.
Powder Mill School renewal sent, it's not checked, but application received.
Yeah,
permit distributed.
I haven't looked at that closely. I'll go through that and I'll double check and make sure all of them are done.
All right, she's got 2 pages.
Yeah, because I don't know if towards the end, I don't know if Dee was still updating on that spreadsheet, so.
Well, this needs to be fixed too, not only application, but what they need to do for certificates.
Right,
like
yeah.
that.
So I'll verify on all those, but as far as I know, the only one we're waiting on fees is the Gristmill.
So
Gift
something
Gristmill
like
Cafe.
that should be digitized.
Yeah, oh yeah, absolutely,
They don't do paper.
absolutely,
Okay,
yeah. So next year it will be,
You put it on the shared thing.
yeah, put it on the share drive and check them off and good to go.
no, turn that, yeah,
No,
turn that other one the other way.
No, I actually want, okay.
Turn it, yeah, there you go.
Nobody is there for us that wants to come on.
no,
No,
just Cliff still,
and he must be taking it out.
yeah.
Okay, and then she's got, then this must have been something that either Jess, because, yeah, Cindy has stuff here from 2023, I guess she did some work for retail food
Oh, okay,
as opposed to service.
Yeah.
And then tobacco. But
Yeah.
this is nice, tobacco, and then tanning.
Or maybe, Dee
Cindy-
did do that,
No,
somebody did. it.
Cindy did it,
Oh,
and
Yeah.
then I see D continued.
oh, okay,
But this must be on the shared drive or whatever, but we could put another couple columns in there.
Yeah. Yeah, I think that would be,
I mean, I can take a look at that.
yeah. Yeah, well, I mean, we don't have to set that up until renewal season's getting close in the fall. But yeah, that would be good to have on the share drive rather than a binder. PHE nursing grant, we already covered that. The spray park, so we did finally have the meeting on that, and it seems like it will be regulated through DEP. And according to the draft regulations of the new draft regulations of swimming pools, if they do design the type of spray park that they're planning on, it will be exempt from meeting those regulations. So we won't need to have any direct role in it. But they were working with Arla Vec and Randy Brown from DPW. So they were going to keep me in the loop, and that way, if something changes, I can catch the red flag and say, oh, then we need to do X, Y, and Z.
So it's gonna be under DEP.
Yeah, for the groundwater discharge, it will probably be under DEP, and then they'll be exempt from the DPH regs because they're not treating any they're not recirculating any water that they would need to treat. So
no, just dump a bunch of chlorinated water into the stream, right?
yeah. So
wait a minute.
that's why they got to go through
So
DEP.
groundwater
So
discharge.
they have to dechlorinate it before it goes into the ground, basically.
It
So
has to be dechlorinated.
I think so. It's
Yeah, I can't imagine DEP allowing them to dump thousands of gallons
right.
of chlorinated water.
Right, yeah,
Yeah.
and they were saying too, I think the estimate that I had been told was like 22,000 gallons a day. And that would be like peak constant use all day. Whereas I think the park, it has like a button. So if no one's there, it's not just gonna be spraying out water. So that when the kids want to play, they would go up to the thing and press the button, and then it runs like it'll go through a program. So I don't think it will be that much water, but they'd have to design for the peak. So
And it's going to
Um,
be shut down when they have a water ban.
they did talk about that. I would think so. So
You would think so or no so?
yeah, I don't know. So, but
Right.
I think that seems like that was the plan.
Okay,
So that will be something I'll keep my eye on, but I don't think we will need to have any direct role in it other than making sure nothing's gonna change, so.
And if, and then did you say, and then if, when the poll regs come out, they'll be exempt from them?
Yes. Yep. As they're written now, but I looked up the draft, and if it was, town water and then going into the, just into the drain, then they don't need to meet the regs, so.
But it's gonna be chlorinated water and they have to have dechlorination.
Yeah, or something along those lines that is regulated through DEP,
Okay,
so.
so we have nothing to do with it.
So yeah, that won't be us. We had another staff meeting this week. With me and Chris and Trisha. We mostly just talked about all the PHE cart stuff that we talked about earlier. And then we're gonna set up. I think we decided on the first. I think we're gonna meet monthly before the first board meeting.
Oh, good.
So that way we'll have. Just if anything comes up, since they're not always, in the office at the same time or anything, that way we can make sure the three of us are on the same page.
Thank you for doing that. That really helps them out.
Yeah, yep. I think so. So, and then unanticipated items, I already mentioned the housing inspection. And then Sue mentioned the other day, and I got an email from the state. The state has updated the model well regulations. So that is something that we can look into adopting. However, I was doing a little research, and there is a bill before the state Senate to essentially create the private well equivalent of Title V. So that would be state well regulations, and they would have to have the water tested before a sale, and pretty much the same thing as Title V. So I was kind of thinking, we've had our well regs for so long, and they work well enough. I was thinking maybe we should wait and see a little bit before. You mentioned the same thing happened with massage, 20 years ago or whenever that was. Yeah.
Yeah.
Right.
Yeah.
We
And after hours and hours of working on that.
Yeah, we might not want to spend the time updating our regs and then have the state say, oh, we adopted this, so yours are irrelevant now, so.
But did they give you like a time frame which they think? this will
No,
happen?
not yet, but I was thinking of just waiting and see if it happened in this legislative session, if it seems like there's gonna be any action on it. We could see, and
So these regulations for wells that is it another? What I was telling you about, is it just an update to the draft? Or do they think this is one they're gonna go with? And was it from DEP? Was it from-
DEP, yeah,
Yeah.
yeah, so it's a fully updated version of the model well regs, which boards of health have the option of adopting.
Okay.
And we
Is
could
it-
change,
is
we
it
could,
an update to that other update?
yes,
First update.
yep,
Okay.
yep, so it was it came out, they published it on, I think the 28th, I think they published it, so. So yeah, it's something we could,
So who would be working on the Title V equivalent?
that would be DEP as well. So the law, the bill that they want to pass would basically order DEP to create those regulations. So
So the bill has to be passed and then they give it to DEP So that's another, what, 5, 6 years, you know? I
Right.
mean,
Yeah.
And
Yeah,
then it's under their jurisdiction, or under our jurisdiction still, but we use the regs.
I think it would be similar to Title V where it's,
Where we're.
you know, they have the option to get involved if they want to, but 90% of the time it's
It's
us.
us.
So yeah, I'm gonna monitor that and then, you know, the other thing too is I want to compare our current well regs to the, because sometimes they put out a revision. I know ours is, you know, it's been a while since we've updated it, but sometimes they put out a revision and there's really nothing significantly different. So maybe we wouldn't want to go with the whole model and make some smaller changes that could hold us over until, because even if it is a few years, that's just a pain for everybody to have to, for all the well drillers, you know, have to learn how we have to coach them through our new process, whatever it might be, and then for it all to change to the state thing anyway. So yeah, I'll keep an eye on that and I'll probably start parsing through the new model ones and see if, you know, maybe there's some really good changes and we would want to update it, but
Did you talk to the building inspector and show him that our well regs say that you don't issue a building permit until
yes, I did.
conservation and the well water is
Yeah.
potable?
So yeah, that's everything.
So what are you gonna do tomorrow?
Hope I want to get over to the grist mill and Xantos and finally do some food inspections. I've been doing so much like office administrative stuff and I haven't had, it's been a lot to get a hang. I think I'm starting to get a hang of it, so hopefully be able to get back to getting out, or not get back to, start to being able to get out and do some inspections, so.
So what other places have not been inspected, like La Patisserie, has that been inspected, or Roma, Big Y?
oh, I don't know.
Tuck
Yeah,
House?
I do, I have
Guess
Tom, I have Tom coming in tomorrow, because the day that I was scheduled to meet with him last week, to talk about the 4 dads, which is going into Krabby Joe's. That was the day I ended up I was sick, so I couldn't make it in. So we're finally rescheduled with him he's coming in tomorrow morning, so gonna talk to him about that and a few other things, so I'll check.
Krabby Joe's.
Yeah, it's on the ponds, right on the Suffield line, basically.
On Connemara Road. And there used to be another breakfast place attached to it.
Yeah, it's what?
It's gonna be a brew pub, I think, and they're calling it 4 dads.
You know, the ones that are gonna put the marina,
Yeah, that's Mr. Eggleston.
right?
Is that who?
I think so. I
Okay,
think, yeah.
oh, so it's not a new owner.
No, yeah, I think
Okay.
it's Eggle. I think I haven't met any of them yet. But if I remember correctly, what Tom told me is it was Eggleston and then his business partners, they're 4
Okay.
dads, so that's what they're
Yeah.
calling the
Yeah, because they have to
restaurant.
go through conservation.
so.
And then I'm not quite sure, okay, I'm not quite sure if Roma was inspected since COVID.
Yes,
Because Alex went to do an inspection and the person in charge said the owner's not here, so we don't want you to go into the kitchen.
well, you're going to have to go over the
Yeah,
records and find
yeah.
out when they were
you-
last inspected. And
do you-
then the ones that haven't been inspected
Right.
for a long time, that
Right.
was your priority.
Yeah. Do you guys know if Tom or Alex or Tammy, if anyone kept a inspection log? Like in Westfield, I kept a spreadsheet and it had like the date that I did an inspection at a certain place, or is it just manually going through all the folders?
Ask Tom,
I'll ask Tom
Yeah.
tomorrow.
maybe it's
Yeah.
like going through the folders.
Yeah.
Yeah,
Maybe you should just start fresh.
right,
You're here, gonna do them all.
right.
Well,
Right.
there you go, Sue. Well, it's another job for you.
Yeah, but I just want to inform our cabinets like 16 more doors.
Hmm.
Okay,
All right.
well, it seems like you've been earning your paycheck.
Yeah, I think so. Think so.
You're gonna get the record retention,
Yep,
gotta figure out to do the old reports.
Yep.
You're gonna order some banker boxes.
banker boxes.
I
Yep,
wish we could just order 2.
Yeah.
instead of 5,
yeah,
but maybe other departments can use them.
yeah,
You don't know. With all the stuff you're going through, you may have enough to fill up.
yeah,
Well, right now. Okay, right now, the only thing I've taken out are those septic things. And then, once I find out about the record retention,
right.
Well, I think the only retention or the longevity for retention is related to financial. You
Right.
know, like, the turnovers, you have to keep those for 7 years.
Right.
And then I don't know if there's anything that's in the Board of Health
Yeah,
files that you have to keep for perpetuity.
Yeah.
It's-
yeah, I know the only one I can remember off the top of my head is food inspection reports. And I think I'd rather keep more than the requirement is only that you keep the most recent inspection. Which I think it's helpful to have at least a few
Mm.
historical ones, just to see whatever repeat violations were or whatnot, but
Right.
but I'm pretty sure that's all that's required is the most recent one, so,
But then again, you can scan the reports,
right,
put them under a folder called Roma or.
Right.
You know, Four Brothers or.
right,
You know,
But if you get this-
McDonald's or whatever.
get this electronic inspection thing.
right, then they would all be maintained digitally that way,
So when I
so,
was going through all the samplings for the beach, they're all chain of custodies and there's, 4 sheets attached for every. Do
Yeah.
we need them from 2000?
yeah, if they're that, I'd be surprised if we need that. Maybe the most recent few years, but I'd be surprised if we needed the two thousand
And then
three
there's,
ones.
and then there's for the year, then there's a sheet that has all the results. Seems to
Mhm.
me, all we need is that result. We want to keep it for historical to go back and check.
Right,
Okay,
Okay,
all right,
so next meeting is
2 weeks from tonight,
16th,
is it?
6 P.M. Hopefully.
Oh, TBD, it's TBD.
oh,
Okay.
that's something I'm supposed to put the next meeting on the.
No, we said.
That
Well-
was how it was on the agenda I copied from, so I've just been doing it that way, so
That's because,
3:16.
who knew
Could I,
when we
could I,
started
could I
doing
chime in here for a second?
Sure,
I'm sorry. I actually got caught up writing another story. I was trying to listen to what you were talking about, and I was trying to listen specifically about the steakhouse and the spray park. And I think I just glanced right over both of those. I'm writing another Fanian trial story.
okay,
Are these meetings posted on the YouTube site for
It
Southwick?
will be,
yep,
maybe
They-
not tomorrow, but by Monday.
yep,
Oh, that's fine. That's fine. Because I do want to write a story on the spray park and I want to seek out this steakhouse. Is this steakhouse new?
yeah, they just opened, they are on, sheep pasture. It is where, it's the same spot that it's been a few different restaurants. It was Walk on the Water and
Louis B's.
Louis B's and Lake Life 101. So they're in there and they seem pretty committed. So hopefully they will stick.
They're right next to the boat launch. the
Yeah.
Town boat launch.
Oh, okay. Okay.
On Blue Pond.
Well, thank you so much. At some point I will be attending these meetings. I promise.
All right.
But I am just caught up in this trial thing right now, and it appears I'm going to be covering it for the Republican next week, which,
Oh, wow.
Oh,
yeah, I didn't expect that.
Yeah.
In the meantime, I'm looking forward to meeting all of y'all in person. And it's been interesting listening when I was trying to multitask, which I'm not very good at.
so you're not from around here, are you?
I don't hear that very often, as you can imagine. Oh.
No, I bet y'all ain't from around, right?
No, I actually grew up in North Carolina, and but my wife and I have been in Massachusetts since 2014, And we've adopted a son up here since we've gotten here. And we were vacationing in Massachusetts for almost 20 years, even from North Carolina, which is kind of interesting. Most people you wouldn't think would go north for a vacation, but we did.
Yeah.
And but I'm looking forward to working. And I was the editor of a daily newspaper in Fitchburg, and I covered the spray park that was built in Leominster.
Oh,
So I had some experience with that.
oh, nice.
So I'm looking forward, and I know the Board of Health is always where the news is. So I'm looking forward to working with you. In the meantime, y'all have a great weekend.
Thank you. You
You
too.
too. Nice.
Take
meeting.
care.
Take care. So, I make a motion to adjourn the meeting at
7:26.
7:26.
7:26. I'll second that motion.
You know, in favor,
Jean Nielsen, I.
and Sue Braska, aye. And meeting adjourned.
Tom will end the meeting for all.